Hello, I'm Dr. Ajay Naik, cardiac electrophysiologist at SIMS Hospital, Ahmedabad. I'm an arrhythmia and heart failure management specialist. Arrhythmias are abnormal rhythms of the heart. The average heart rate is around 72 beats per minute. But any heart rate between 60 beats per minute and 100 beats per minute could be normal. Even a heart rate falling to 50 or 45 beats per minute could be normal. Like when you go to sleep in the night, the heart rate could normally slow down. Or when you are exercising and you're climbing stairs or any emotional or physical stress, the heart rate could go up and the rate could be 120, 140, 150 beats per minute. That could also be normal. But arrhythmia is abnormal beating of the heart. And that can occur when the heart rate suddenly jumps to 150 beats per minute or drops down to 30, 40 beats per minute. So a fast heart rate, more than 100 beats per minute, is called tachycardia. And a slow heart rate below 60 beats per minute is called bradycardia. The reasons of bradycardia could be varying. It could be totally normal, like when you go to sleep, like I said, or when you're resting, the heart rate can drop to 55, 50, even 40, and that could be totally normal. Some people who are extremely fit athletes, their heart rate, resting heart rate, is generally on the slower side. Certain medications can reduce your heart rate, and that may be blood pressure medications, which could give rise to a slower heart rate. There are certain problems which cause abnormally low heart rate, and that could be age related degeneration of the switch of the heart, that is the sinus node, or the junction box of the heart, that is the AV node. Also, certain valve diseases or coronary artery disease or generally aging and degeneration can slow the heart rate down, and that can cause problems. With a slowing of heart rate, the brain doesn't get adequate blood supply, a person can become dizzy, there may be perspiration, nausea, some people get tunnel vision, blurring of vision, some people may get cool, clammy skin. There may be perspiration. Some people have chest discomfort. Some people can get dizzy and fall down. In some people, it can be life threatening. The way to treat bradycardia depends on the cause. It could be simply reducing the medications that you are taking, or some patients may require a pacemaker implantation. This is slow heart rate. On the other hand, abnormally fast heart rates could be again due to different causes. So abnormally fast heart rate could be due to emotional stress or physical stress. So when you climb stairs, that can give rise to a fast heart rate. In certain people, if the hemoglobin level is low, anemia, that can cause a faster heart rate. In some people, fever can give rise to fast heart rates. Now, these are the usual causes of tachycardia, but there may be some other causes which can again cause major issues. So, some people may have an extra wiring in the heart, which, when activated, creates a short circuit, and the heart rate abruptly jumps to 150, 200, 250 beats per minute. Or there are extra foci in the heart, which can electrically get activated and the heart rate jumps. When the heart rate jumps to 150, 200, 250 beats per minute, the blood pressure can drop. Again, the person's brain doesn't get adequate blood supply. Some people may get dizzy, some people may fall down. In some people, it could become life-threatening. Certain heart diseases like coronary artery disease, patients who had angioplasty, bypass, or previous heart attack, whose heart pumping function is low. In these patients, there can be life-threatening fast rhythms. These are called ventricular tachycardia, and that can cause sudden cardiac death. The way we treat tachycardia again depends on the problem, depends on the etiology, why it is happening. In some cases, it may be simply bringing up the hemoglobin by giving hematinics, which can control the heart rate. In some people, certain medications may be required, which will slow the heart rate down. Yoga, exercise, improve the stamina, improve the effort tolerance, and that can also keep the heart rate under control. If it's a question of abnormal circuit, abnormal wires, or abnormal electric foci, These can be very well treated by a procedure called electrophysiology study and radiofrequency ablation. It's a 45 minutes, 1 hour procedure done under local anesthesia. We introduce catheters from the groin into the heart. We look at the electrical signals, find out where the problem is coming from, and then we give heat energy for a minute or two, and that can permanently cure the problem. The patient may not require medications after that. Certain patients who have low pumping function and are getting abnormal fast tachycardia, which are life threatening, may require implantation of a device which is called a defibrillator, which works like a policeman. As long as the patient's heart rate is working normally, the defibrillator will see what is going on and wait and watch. But if this fast abnormal heart rhythm comes up, it will deliver a shock and restore normal rhythm and save the patient's life. So these are various abnormal rhythms of the heart: slow heart rhythm, bradycardia; fast heart rhythm, tachycardia. We need to individualize, diagnose, find the problem, and treat it in a very unique manner for each patient. This is Dr. Ajay Naik, cardiac electrophysiologist at SIMS Hospital, Ahmedabad. Today we talked about bradycardia and tachycardia, abnormal rhythms of the heart. In this series of arrhythmia and heart failure, we will be talking about more such problems and will be giving you more information. Thank you very much and have a safe, healthy life. Take care of yourself and your significant others.